Good evening to all. Today's 33rd medical term that we will be focusing is known as shaking palsy. It sounds a different term, isn't it? Shaking. So when you think of the word shaking, we remember words like trembling, isn't it? Yes, your guess is correct. This is a historical name for Parkinson's disease, a neurological condition relating to a movement disorder, isn't it? So it is a progressive neurodegenerative disorder of the central nervous system, and it affects motor as well as non-motor functions, right? So as we all know, Parkinson's disease is characterized by a set of clinical manifestations known as Parkinsonism. So what really happens is the midbrain, right? In the midbrain, there is a nucleus called substantia nigra, right? So these neurons in this substantia nigra uh, dies off, or rather, they may be dysfunctional due to structural abnormalities or any other reason. So due to that, the neurotransmitter that is produced by these neurons called as dopamine is not available. So the absence of dopamine ultimately leads to Parkinsonism. So what are these signs and symptoms that are together known as Parkinsonism? Primarily, there are four main symptoms. One is tremor, which is a rhythmic rubbing of the thumb. You just that's why it was earlier known as shaking. Then there is rigidity, where the muscles are very stiff. They are resistant to contraction and and relaxation. So that the pipe process will not happen. Bradykinesia, as we know, the word brady means slow. So slowness in their movement, slowness in the neurological impulses, reflexes, and even postural instability. So there's an impaired balance and coordination. So how do you treat these people? We can provide drugs like levodopa, MAO beta inhibitors, and anticholinergics. That is against the certain molecules. Then we can go for therapies like physical, occupational, and even speech therapy, or surgeries like deep brain stimulations, where you implant electrodes to send electrical signals to the brain because the midbrain is affected. So, this is a quick summary of shaking palsy, a term used for Parkinson's disease earlier.